Hello, it is July the 29th, and we're so excited to be here today for a sort of a grand reopening and restructuring of Advantage Behavioral Health here in Walton County. I have just found out that this office also covers Clark County. My counterpart from the Athens-Clark County Chamber of Commerce, Doc, is here as well. I'm going to give him a chance to say a few words, who's also chair of Advantage Behavioral Health. But this time I would like to go ahead and ask the Mayor of Monroe, Greg Thompson, if he wants to say just a couple of words.
Just on behalf of the city of Monroe and actually Walton County too, we just appreciate what Advantage Behavioral Health does for the county and other counties around here. And we're just glad to have y'all and have this rebranding of what's going to be going on. Interesting to hear about it, and for the city of Monroe, we're just glad y'all are here.
Thank you so much. Thank you, Mayor. Doc, you just threw me completely off guard when you showed up today, so it's your show now.
Terry and I know each other through our Chamber of Commerce connections, and she looked at me, as did Sunita Singh, who's very active with us, and they said, "What are you doing here?" And Sunita said, "We have free food." So, no, I've been involved with Advantage for a couple of years now and have really come to appreciate what a great job they're doing in the 10 counties that they serve. And they're helping those that need the help the most and can afford to get it the least. And so, like other communities, Mayor, you have special needs and special people that need special things, and these people are here to do it. So I'm proud to be associated with it. I'm glad I could be here. I'm glad to know that you cover Athens too.
Yes, awesome.
I want to introduce y'all to our new Chief Executive Officer, O.J. Booker. Comes to us from a long career in healthcare in different capacities. He's been with Advantage for a year or two.
2 years.
A couple of years, and on January 1st became our new Chief Executive Officer. So let's give O.J. a nice warm welcome.
Thanks, Doc. I just want to say thank you all for being here. It takes a lot of time out of your day, and I'm very grateful that you would do that and honor us in this way. There's a couple of things. First off, I want to say thank you, not just to you for being here, but I want to thank the county for what they give back to us. Yep. We've been in this building since 2000, and guess who built it for us? You did. You contribute to Advantage Behavioral Health, the behavioral health piece and the DDPs, probably in cash and in kind over $230,000 a year. We are very, very grateful for that. I think somewhere over $80,000, north of $80,000 in cash, and then these two facilities in the county that we have are provided to us so that we can give care, as Doc said, to those who cannot afford it. And the other thing that you need to know about us is that we are truly a safety net. I can't say that often enough and hard enough. Is that the consequences of not having a behavioral health organization like this is serious. And I think probably the sheriff could talk to that, the police officers could talk to that, and probably a lot of other people, including the physical health people, could talk to that. So for all these reasons, we are glad to provide these services, and we are glad that you thought enough of us and wanted to invest in us enough to provide us a place to come and serve those, the least of these. Okay? I'm going to say that's about it for me. I just wanted to express my gratitude, and I'm going to turn it over to Laurie Wilburn Bailey, wherever she is, to come on up. And Laurie's our clinical director, and she will describe some of the services that you'd be interested in hearing about.
Yes, Advantage has been providing services to folks with mental illness, addictive disease, and developmental disabilities for going on 40 years now. And we realized over that time that sometimes it takes more than just what you think of as traditional mental health care or addictive disease care. So for that reason, we're very proud to offer the whole continuum of care services. So starting at the highest level, we have a crisis stabilization unit. It's located in Athens, but anybody in the state of Georgia can access services there. They generally stay 5 to 10 days to stabilize their symptoms of mental illness or to detoxify from substances. And then when they leave, we connect them to other services. That might be a day program for mental health or for addictive disease where they need to learn about their illness. They need to learn how to build natural supports, and they need to start on their road to recovery. It might be that they need assistance every day or at least multiple times a week. So we might connect them to an assertive community treatment team or intensive case management or community support team services where people go and provide them their services in their home, in their community. We work very closely with the court here. We're very excited to be a part of the Treatment and Accountability Court here in Walton County for folks whose mental illness impacted the choices they made that got them in trouble with the law. And we believe it's important to have that treatment component hand to hand with the accountability component, because just locking them up and not treating them means they're going to do the same thing over again and cost your county more money in the long run. So we are very excited to be working with that program. We have a women's services program where women with their children can live while they get treatment for addiction, parent education, and they graduate with a job, with housing, and with their defects case resolved. So we're very proud of that. We provide other residential services for folks who might need to be checked in on once a week, or they might need somebody to be there with them 24/7, and we have everything in between. We then provide what we consider more of our traditional services. And so I'm going to tell you a little bit about what we do out of this clinic here. We have counselors, psychiatrists, psychologists, social workers, paraprofessionals, peer specialists, everybody kind of coming together to provide multidisciplinary team approach to treatment. So that might be individual therapy, family therapy, group counseling, crisis evaluation, intake and assessment, medication management, medication administration. So those sorts of things you think about that you'd come into a clinic, you'd receive a service maybe one day a week, and then you'd go home and then come back and see us again a week later, a month later, a couple months later. So we try to make sure that we have something that fits for each client. We're not trying to fit our clients in a box, but trying to create special treatment plans for whatever someone's needs are. That sort of covers our mental health and addictive disease sorts of services. And then we have Barbara Jeter, who is our director for developmental disability services here in the community as well. So sometimes our folks are at her place because they have co-occurring diagnoses. Sometimes hers are at our place, and we really try to work hand in hand. Taryn Tripp, our director of clinical operations, is going to tell you about some of the changes and why we wanted to have this grand opening.
Hey everybody, thanks for coming. So one of the big reasons, like Lori said, that we are having this reopening is we are doing some very exciting changes in our policies and the procedures and the way we do things. The primary reason of why we are doing that is we want to increase access to our community. We want to make it easier, faster, and better for folks when they are ready to get treatment. We are ready to help them and ready to serve them. And so that's really the cornerstone, the pillar of why we are doing this. We've been calling it the Butterfly Project because we really want it to represent the transformation that we are going to make as an agency to make it easier for all of our communities to get into services. We piloted the project here in Walton, and that's why we are doing this here today. And some of the things about that is open access, like I said. So folks will be able to come in, they can walk in, and they can get an intake appointment, and they get into services much faster. That not only with therapy, but with our medication services. So we would like them to be able to see a medical doctor within 5 days of a need being identified. The next thing we're going to do is we're going to kind of streamline how you can get in touch with us through a centralized scheduling unit. Something we like to say is there's no wrong door. So we're going to have a team of professionals ready to help. So if you call a different center or you call somebody else who is affiliated with Advantage, they'll be able to help you and get you in a much more streamlined fashion. And there's a lot of other things that go along with that. We're revamping and making sure that we have good customer service and that it's just easy to access services and that we can provide the best care and treatment for a healthy path to recovery. So I appreciate you guys all for being here. Anybody else have any words they'd like to say?
So no, but the staff will be around, and so feel free to talk with any of us about any questions that you have or anything that you want to know. And I see some other staff have come in. This is Dr. Betsy Stewart. She is our quality director, and you guys met Barbara, right? So if Advantage people raise their hands, including Doc. So we would definitely, any of you who want to stop and chat with us, feel free. The building is open and we'll be standing around the building to answer questions for you.
And, let us not go any further.
Yes, I'll do.
This is your local representative. She's actually the clinic manager, Nikki. Have you been here for?
7 years.
7 years. That's a long time.
Thank God.
It doesn't seem like that long at all.
So any of the local folks that have a problem, this is your person to come to.
Or compliment.
Thank y'all for
I
coming.
just want to ask a couple of questions, just to verify a few things, just for the folks watching, watching the video. So you don't have to have a referral from a doctor. You can just walk in.
Correct.
You can call and make an appointment.
Correct.
Give us your phone number.
770-267-8302.
Okay. And give us your location here in Walton County.
834 Highway 11, South Monroe, Georgia 30655.
Got to cross
the railroad tracks.
Very good. And then what are your hours of operation? What hours are y'all open?
Monday through Friday, 8:30 to 5.
Okay. Very good. I guess you can be referred by your primary care physician.
Absolutely.
Or
There's
walk
no
in
wrong
or
door.
call.
Absolutely.
Okay,
Yep, not
great.
necessary, but you can.
Very good. Well, we appreciate the services that y'all offer Walton County. Absolutely great. And I know y'all been a partner of the chamber for quite some time, so we appreciate all that y'all do.
Thank you.
And we'll go outside now and cut the ribbon. 2, 3.